Afternoon. So we have a very tight schedule, and so I was given the instructions that 1 o'clock is 1 o'clock and we have to start at 1 o'clock. So welcome to the grand opening of the Touro College of Dental Medicine at New York Medical College. My name is Ronnie Myers, and I am the Senior Associate Dean for Academic and Administrative Affairs here at the college. I would like to extend greetings to our distinguished attendees, Rabbi Krupka and Sokol, our good friend and supporter, New York State Senator Terrence Murphy, members of the Board of Trustees, members of the Touro College Board of Overseers, President Kadish. I don't think Provost Sulkin is here. Where is she? Oh. Madam Provost Sulkin, Chancellor Halpern, Executive Director of the New York State Dental Association, Dr. Feldman, President New York State Dental Association, Dr. Adelina, President-elect of the 9th District, Dr. Lukasiewicz, Founding Dean Goldsmith, Senior Associate Dean Farkas, faculty, friends, and guests. 100 years ago, in 1916, William Guy's, a biochemist and yet arguably the founder of dental education as we know it, presented a proposal to the trustees at Columbia University to establish a dental school. That proposal, known as the Guy's Report, a dental school along university lines. It was the first time that a relationship between oral health and overall health was put forth in a dental curriculum. During the next 65 years, the number of dental schools grew to 64, almost all of which were in research institutions. And in 1976, the number of dental school applicants was greater than 15,000 for the approximate 6,000 first-year enrollees. In the early 80s, however, schools began to close. Other schools dropped enrollment, and by 1990, the number of schools had dropped to 53. Applicants to about 5,000, a third from before, and entry students to 3,700. Many reasons are given for this significant drop-off, including cost of dental education, decrease in the applicant pool, poor economic return on investment, and universities repurposing space, just to name a few. However, things changed in the 90s, with new schools opening due to increased applicant demand, expansions to areas in the country where there were no dental schools, and the perceived need for increased number of providers. The new school paradigm was focused on primary care, with newer institutions not being focused or not being associated with medical centers and research not being core to the mission. This history is important as it brings us to the unique opportunity that was developed here at Touro. As the 66th dental school and the first in the New York area or New York State in almost 50 years, we have positioned ourselves in a way that no other new school has, in that we have built the newest technology into the educational program. We have taken on primary health care as a focused mission. We will incorporate interdisciplinary care in our clinical environment. And lastly, and maybe most importantly, have embedded ourselves in a world-class university at a medical center so that research will be a core value. In the end, the graduates at the Touro College of Dental Medicine will be true to the mission to graduate outstanding dental professionals who will utilize a complex knowledge base and sophisticated perceptual skills to deliver excellent healthcare service to their diverse communities with integrity, compassion, and empathy. I thought I'd end with a quote from John Krakauer's book, Into Thin Air. As you may know, it's the story about climbing Mount Everest. Now, many mountaineers have attempted to climb the tallest peak in the world, and yet only about 4,000 have reached the summit. But it's actually more astonishing that there have been approximately 200 deaths, meaning that for every 20 thrills of victory, there's been one agony of defeat. And I quote, "It is easy to lose sight of the fact that climbing mountains will never be a safe, predictable, rule-bound enterprise. This is an activity that idolizes risk-taking. The sport's most celebrated figures have always been those who stick their necks out the furthest and manage to get away with it." End quote. So I think we're here today to celebrate our risk takers. Many in this room today, 3 or 4 years ago, had a dream. They took a risk and made it a reality. I, the new students, the faculty, and the future patients of the Hudson Valley will be forever grateful. Thank you. So now it's my great honor to introduce Dr. Alan Kadish, who currently serves as President and Chief Executive Officer of the Touro College and University System. Chartered in 1970, Touro has grown to become the largest Jewish-sponsored educational institution in the United States, educating approximately 19,000 students at 32 locations worldwide. Alan was born in Brooklyn, raised in Queens, and educated in yeshivas in New York. He received his MD degree from the Albert Einstein College of Medicine at Yeshiva University and has postdoctoral training at the Brigham and Women's Hospital, an affiliate of Harvard, and at the Hospital of the University of Pennsylvania, where he was a fellow in cardiology. He's a board certified in internal medicine, cardiovascular disease, and cardiac electrophysiology, and is not a dentist. Dr. Kadish.
Thank you very much, Ronnie. The one part of my bio, Ronnie, that you left out was that I was an undergrad at Columbia. Ronnie spent about 35 years at Columbia, so I'm not sure if that was intentional or not, but I don't think we overlapped, but it was a good time as well. I'd like to begin by acknowledging a couple of the people that Ronnie Myers mentioned, mostly because they were so important to this enterprise. Senator Terrence Murphy has been an unflagging supporter of New York Medical College and the Touro College of Dental Medicine, has been a visionary state senator, represents our district, and recognizes what both economic development, student education, and research can bring to the fabric of life of Westchester, as well as the health care that we're going to help deliver. And so we appreciate your support, and it's been tremendous. Carol Summerhill is president of the American Dental Association. She told me that she made a special trip to get here on her way to Washington, and we very much appreciate her being at the newest dental school in the country. Once she gets to tour, she'll be able to tell us how we're doing. So I'm just going to tell you a brief story. Ronnie Myers told you a little bit about the fact that about 4 years ago, we were exploring the possibility of beginning a dental school. And some of the people in this room, as well as some of the relatives of people in this room, formed part of the consulting group that looked at this proposition. The meeting was downtown in my offices. We had an external, the most experienced external advisory group in the country on dental medicine, we believe, a group called ALA that came in, and we had two groups present to us. But in the room was Rabbi Krupka's brother, who's a dentist, and Mr. Katz's brother, who's a dentist. And they helped us try to craft the vision for the Touro College of Dental Medicine. We did recognize that it was going to be a somewhat arduous task, but we decided to dream a bit, and we're thrilled that you're here today to join us in that dream. And if the two of you could please pass our thanks on to your brothers who helped us start this, that would be great. My My job today was made a little bit more difficult. Dr. Joseph and Mrs. Sylvia Schwartz have been generous donors both to the Touro College and University system and to the Touro College of Dental Medicine. They've made a generous donation that's helped in the construction of this floor. The plaque recognizing their donation is on my right. Joseph Schwartz is a cardiologist, and so he's got a special place in my heart. And we're absolutely thrilled by their support. Unfortunately, they had a death in the family today. So what we're simply going to be able to do is to acknowledge with great thanks their generosity, their support, their commitment to the institution, commitment to healthcare education, and commitment to the community. And as you go on the tour today, you will see just to my right the wall plaque that recognizes their donation. Finally, the Schwartzes have sent 4 of their children to Touro, so they've voted with their feet in this case, and we appreciate that. As you tour the facility today, I hope that you'll notice that this wall is one dedication opportunity, but there's some others around. We think that we've built a great facility here, but we've got a lot of work left to do in the dental school. Ed Farkas, who was integral, was one of the presenters that day at our first meeting and made a much more compelling presentation than the other group, which is why he's here with us today. Has done a great job working with Ronnie Myers and Jay Goldsmith, the dean, to help design this floor. But we've got some great plans for the floor below us. We've got some great plans to be able to provide dental care integrated with health care to some children with disabilities and who are disadvantaged. And we've got our new provost for research at Touro College, Solomon Amar, who's with us here today. He happens to be a dentist as well as a PhD, and has got some extraordinarily creative ideas about how to make the things we do for our patients work better, how to make bones grow faster, how to make implants easier, and how to improve oral health. So we really hope that working together with you, we can continue to make our dreams a reality. We're quite frankly amazed at what we've done so far, but it's with the help of the people in this room that we've been able to do it, and we believe that with your continued help, we'll continue to be able to do that. So with that, I'm going to thank the Schwartzes in absentia once again and turn it back over to Ronnie. Thank you.
It's now my distinct pleasure to introduce Dr. Solomon Amar. He's the Provost for Biomedical Research at the Touro College and University System. He's Professor of Pharmacology at New York Medical College and Professor of Dental Medicine at Touro College of Dental Medicine. In addition to his dental degrees and certificates in histology and cytology and periodontology, Dr. Amar has an MS in skeletal tissue and a PhD in developmental biology. Dr. Amar's postdoctoral training was in biochemistry and molecular biology at Northwestern University. Solomon is a nationally and internationally recognized authority on periodontal pathogens and has made significant contributions to the field of inflammation and host response. We are delighted to have his expertise applied to his role as research provost to the College of Dental Medicine and look forward to working with him as we continue to build and strengthen our research mission throughout the Touro College and University system. Ladies and gentlemen, Dr. Solomon Amar.
Thank you very much, Dr. Myers. This is overwhelming. I don't know if I can match the expectation this morning. Anyway, as President Kadish mentioned just a couple of minutes, we are amazed at the achievement. And as I was sitting and listening to this, I can't think of a better correlation. In 6 days from today, we are going, and the Jewish people are going to celebrate what is usually loosely known as Rosh Hashanah, 6 days from today exactly. And tradition tells us that on that day, mankind was created. 6 days from, if this is true, we're sitting today, 6 days from today, as the first day of the creation, and that's no omen that would be for the creation of, in the inauguration of a dental school, how interesting this would be for the dental school, and how interesting it's going to be for the donors in absentia, the Schwartz family, as well as any other people that are going to be interested in this venture. So I was asked to give a little bit of the perspective in regard to research. And I want to tell you that American universities that have balanced emphasis in teaching and research have demonstrated a tremendous and favorable outcome when it comes to the student, related to the academic growth, related to the disciplinary skills, related to their well-being in an environment. And as such, there's many commissions in education that were interested into looking at this. And one of them is known in education. It's called the Bauer Institute, that is teaching and advising people to train and educate students as apprentice teachers. Therefore, teaching and research should be part of the same enterprise, and it comes into a medium by which learning could link both of them. Therefore, we believe that teaching, both of them, teaching and research, involve a personal growth that is, to a certain extent, developmental. Touro Central Administration, under the leadership of President Kadish, made a very bold commitment, and I call it a bold commitment, specifically to engage and to being able to weigh and have biomedical research and biomedical research weigh a little bit more into this balance of teaching and education, knowing clearly that's going to be favorable to the future of our students. And for that, we should all commend Central Administration and President Kadish for taking this bold move. When it comes to this dental school, ostensibly we are the youngest school of the 66 dental school and 10 schools in Canada. And as such, and I don't like, and I will not hide the challenges. There are plenty of challenges that we are, and I'm 100% sure that we are going to meet the challenges. But one advantage of this is the fact that being the youngest school, we want to draw and learn from the experience of other schools, to being able to use that information as a springboard when we are formulating a strategic planning and charting the future. Future that is extremely bright, I would like to tell you. Why? Because dentistry and dental medicine has contributed significantly into the well-being of the nation. That dental research has participated in several innovating projects that had many implications in imagery, in human microbiome, in the human genome, in cancer. And close to home, I want to tell you something, that saliva may be in the near future something that will replace blood for testing. And as such, dentistry, as the Surgeon General said, you cannot be healthy unless you orally and dentally healthy. This is part and parcel of your human being, and as such, dentistry becomes a discipline of medicine. So we are witnessing, and I'm proud of it, to be part of this wonderful institution, but also to live through the wonderful technological, biomedical revolution that we are witnessing today, and that our vision will embrace. And with that, we have prepared arguably a very, very ambitious, but yet realistic to the curriculum, a dental research program for the dental student. We are fortunate to be strategically placed within a medical campus, and as such, we will foster a very important aspect that the dental school should remain within the fabric of a medical campus for multiple reasons. This should be, however, a bi-directional relationship. We must take, as dentists and dental educator, we must take an active part within the medical campus, and as such, there will be reciprocity where our medical college are going to help us. This will open, and I've already engaged many people at the medical school, this will open and have the possibility of having our students rotate for their research program with our colleagues in medicine and have a wide variety. Now that dentistry doesn't stop at teeth and gum, but has transcended this phenomenon with having microorganisms affecting the heart, for example, microorganism involving rheumatoid arthritis, in Crohn's disease. We will be able to offer the student with an opportunity to have a research program that is at the level of a medical school. So what do we say now to our stakeholders? To the students, and they're not here, but we will convey that message to them, I would say carpe diem, seize the moment, make sure that a day doesn't go by when you don't learn anything. At the end of the day, you must say, have I learned something? And if you didn't learn anything, it's a wasted day. Seize the moment. We cannot afford to lose you or to fail you. You're too critical to us. This is a wonderful class. I have interacted with them recently. It's a wonderful class. The fabric of them is just magnificent, and as such, they need to take advantage of the fact that we will make them successful, guaranteed. To the staff, I'm gonna say thank you, and thank you, because without them, we will not be able to do it. To the faculty, I will tell them clearly, try to do the best on them. Provide the cutting edge, state-of-the-art teaching. The fabric of these classes and class that are coming also is just magnificent. Take the moment, give the best of yourself in terms of teaching. And last but not least, what can we say to the administration? I am a dual citizen. I am a professor at the medical school, but I'm also in the administration. What can we say to the administration? Well, let's say continue to raise money so that we will be able to implement this wonderful program that we have, and make sure that we will, at Touro, choose to be great. Thank you very much, and Happy New Year.